We're going to be talking about chapter 7, which is the appendicular skeleton. Earlier we went over, previous lecture was chapter 6, the axial skeleton. And I'm hoping that when we have some live Zoom time that I will be able to kind of go over this stuff on the real bones themselves. But for now, we have the PowerPoint, and you should have your appendicular bone list up, as well as any other labeling documents. You can take notes on helpful hints that I can go through. So first off, we talked about the axial skeleton in chapter 6, and now it's the appendicular skeleton. And so the axial skeleton is really the axis of our body, right? So we have the craniofacial bones, the vertebral column, sacrum, and then we have all the ribs that attach, and the sternum. On the back side, we have the sacrum here and here. This is all axial. And I'll just color that in. All right. So axial is pink. And appendicular appendages. So that really is the pectoral girdle and the upper limbs, and then the pelvic girdle and lower limbs. And so the pectoral girdle is the clavicle that's anterior, and the scapula that is posterior, that you can see posteriorly. We kind of call it our shoulder blade, is the scapula, and clavicle is in the front. And that's our pectoral girdle. We have the humerus, it's part of the upper limb. We have the ulnar bone, which is medial, and the radius, which is lateral. So ulnar, radius, and then we have the digits. We have the metacarpals, carpals, and digits. So those are the upper limbs. As far as pelvic girdle, so pelvic girdle is actually part appendicular, part axial, because the sacrum is included in the pelvic girdle. So that's a little bit different. The pelvic girdle, this part are 3 fused bones, and we'll get into that on each side. And then the sacrum. Then you have the femurs, the tibias that bear weight, and the fibulas that are lateral. You have the tarsals, metatarsals, and phalanges. So the pectoral girdle is clavicle and the scapula. And the clavicle doesn't have too many features other than a couple of things. One is the sternal end, and this is the end that articulates with the sternum, right? And specifically the manubrium. So we went over the manubrium on the axial skeleton. The sternal end, if you were to look straight onto the medial side, it kind of looks like a chunky round end, right? So the sternal end kind of has this shape. If you look at the acromial end here, it actually looks pretty flat when you're looking straight at the lateral side of it. And so the acromial end does resemble the acromion of the scapula. So the acromial end articulates with the acromial end articulates with the acromion of the scapula. So they do look differently. Acromial end is kind of flat, and the sternal end is a little more round or chunky looking. There's a few other features on the clavicle. And so this is the inferior view, or the bottom. You have a little bump here. What's the conoid tubercle? And that bump, you can kind of see, let's see if we have a skeleton. I'll show you. It's because the rib 1 is there. And so you have a little bump kind of over here. You can see that. That kind of hits that rib. And so you see it right here. being the rib. And then you have the costal tuberosity. It also is kind of over here hitting that rib. So they're just little bumps on the inferior side. Scapula is a little bit more, has more things to it, right? So we have an anterior, a lateral, and a posterior view. Now, the shape of the scapula or shoulder blade, right, is kind of a triangular shape. And a couple of things to note, there is an anterior side and a posterior side. When you look here, the anterior side is pressed up against the rib cage. So yes, it's a bone that is posterior, but it does have an anterior side. That anterior side is pressed up against the ribs. And this whole kind of area here is called the subscapular fossa. And the subscapular fossa is where the subscapularis muscle is located. So the good news about the scapula is you're going to learn supraspinatus fossa or supraspinous fossa, infraspinous fossa, subscapular fossa. All of the muscles that are located in those fossas are named for those fossas. So you have an infraspinatus, a supraspinatus, a subscapularis. So this is the anterior view. And anterior, you can see a couple of processes. One is the acromion and the other is the coracoid process. And so from the lateral view, the coracoid process, this, by the way, is the anterior, and this is the posterior side. Okay, so anterior and posterior side, because we're looking at it laterally, right? So this is the lateral view right here. And I'm pointing this out because one way to learn where these things are is also add directional terms that you can associate. So the coracoid process is anterior. You can feel your coracoid process by feeling your clavicle, going directly underneath your clavicle towards where your shoulder is, and you'll feel kind of a bony process in the front. And if you move your arm forward and up and down, you'll feel a tendon on that bony process. That's your coracoid process. It's anterior. Your acromion is actually posterior. And that's what you feel when you follow your scapular spine. So if you reach around the back and you feel this scapular spine right here, so that's the spine, scapular spine. The acromion is an extension of the scapular spine. So the acromion is extension of the scapular spine. And the acromion is posterior. This is posterior view. So you can see the acromion from the lateral view, posterior view, and then again, it's posterior. Coracoid process, anterior, anterior, right, because this is anterior, and then you can see it kind of in the front, anterior. All right, so coracoid process, subscapular fossa. Now the lateral view, you don't generally look at it from the lateral view, but the one thing that you see is the glenoid cavity, but it's also called the glenoid fossa. This is the socket of the ball and socket joint that make up your shoulder. So the head of the humerus kind of sits in this glenoid fossa. Head of humerus sits in glenoid fossa or cavity. And so that's the glenoid fossa. It's always, you know, I kind of remember we have a real bone in lab, and real bones, people mark on ballpoint pen on these real bones, and someone had drawn a happy face on a real bone. And it was kind of a bummer, but I just decided to make some lemonade, and I named him Glenn. So Glenn lives or I should say is, the glenoid cavity or fossa. Here's Glenn. Glenn has some wild hair that comes up and around. That's the coracoid process. So lateral view, you kind of see that, and then we talk about borders and angles, and we'll get to that. Glenohumeral joint, by the way, is the glenoid cavity or fossa plus the head of the humerus. Acromioclavicular joint, that is going to be where the acromion and the acromial end of the clavicle join. So acromion and acromial end of clavicle. Supraglenoid tubercle is a tubercle where one of your biceps tendons attaches. So that's right here. And there's an infraglenoid tubercle down there, right? So inferior to the glenoid cavity, superior to the glenoid cavity. So supraglenoid tubercle is there and infra is there. On the posterior view, you see your scapular spine. That is this right here. And then you have some fossas. So above the spine would be superior to the spine is a fossa. And so this is the supraspinous fossa. It's above the spine. And below the spine here is the inferior or infraspinous fossa. There. And of course the acromion. So here's the way I like to study and teach these things is that I like for you guys to go around the bone. And so my appendicular bone list that you can see, when it gets to the scapula, I've actually put it in a specific order because memorizing things, if you just straight out memorize it, and you don't put it in a specific pattern that you memorize over and over and over again, what happens is you may or may not forget it. So, or remember it. See, I clearly already forgot it. So memorize things in a pattern. That's how we remember the order of the alphabet. That's how we remember the lyrics to songs. They're in the exact same pattern every time. So my list basically starts at the acromion and then goes around the scapula in the exact same order. So you're going around this triangular bone over and over again. And even if it's labeling diagrams, you go around those labeling diagrams in the exact same order. So that being said, I start at the acromion. So the acromion is 1, the coracoid process is 2, right? So 1, 2, 3. And so it goes acromion, coracoid process, and glenoid cavity or fossa. Those are the top areas. Then we have suprascapular notch. So there is this notch right here that is superior on the scapula, and it is anterior. So it's superior and anterior, suprascapular notch. So that is right there. Then you have borders and angles. So this is your superior border and your superior angle. Then we go to medial border. You know that this is medial because here is where your arm is. And your arm is not medial, your arm is lateral. So the glenohumeral joint has to be lateral. So sometimes it's also good to figure out which side of the bone is medial, which side is lateral. This is anterior, and this is posterior. How do you know that? Scapular spine is posterior. Acromion is posterior. Coracoid process is anterior. So orientate yourself. But again, my list goes acromion, coracoid process, glenoid cavity, and then suprascapular notch. Then superior border, superior angle, medial border, and we get down to inferior angle. Lateral border here. And you do have this lateral angle. So back to the list, we're going to go through it. You have suprascapular notch. Then we go superior border, superior angle, medial border, inferior angle, lateral border, and now we get to the faucets. So going back here, we're going to have our subscapular fossa. I believe I put that in that order. Let me double check. Nope, I go supraspinous fossa. So here's where it's not exactly, oops, foolproof, but if we're in the back, supraspinous fossa is 10. So up here. And then infraspinous fossa. Right, so that's 11. And then we have subscapular fossa, which is 12. And the last couple of things that we have is the supraglenoid tubercle and the infraglenoid tubercle, and I'm not sure. Right, so it's 13 and 14. So when we go back to this list again, oh, I missed the spine. All right, so that's in there. But going around this bone exactly the same every time, to me is helpful to remembering this. So you can look at it and say coracoid process, acromion coracoid process, glenoid cavity or fossa, suprascapular notch, superior border, superior angle, medial border, inferior angle, lateral border. And then you can go supraspinous fossa, infraspinous fossa, subscapular fossa, spine, and then the supraglenoid tubercle and infra. Biceps brachii, one of the tendon attachment sites is the supraglenoid tubercle, and one of the triceps brachii is originating from the infraglenoid tubercle. So all of these processes off these bones, they are a location of a ligament or tendon. So there's a reason why there's a fossa. There's a reason why there's a big projection off a bone or a tubercle or some hole through a bone. This is just what we're going through. So we learn all of these things. So then when we get to muscles and we talk about the origin insertion tendons, where they originate from and where they insert, when I say coracoid process, you'll actually know exactly where that is. So the other head of the biceps brachii originates on the coracoid process, and the first one is the supraglenoid tubercle. So that's why you guys have to learn all of these. Anatomy is kind of like building knowledge upon knowledge that you just learned. So we're just kind of building on things. Okay, so the upper limb, the humerus. Again, I tend to, on my list, have it in a slightly different order from proximal to distal. So we'll go through the proximal structures first, and then we'll go through the distal structures. And again, when you look at these, there's an anterior and a posterior. So what we're looking at here is the anterior, right? So the anterior view. And the next thing you kind of want to know is which side is medial and which side is lateral. So this is the front of the humerus. And I could tell you right now, this is going to be the medial side, and this is going to be the lateral side, right, of this bone. And I know this because the head of the humerus is going to point medially, because it is part of the glenohumeral joint. And it is the ball of the ball and socket joint. And so this ball is going to fit in, right, to that glenoid cavity or fossa of the scapula, which I'm not a very good drawer, but that would be my scapula. So this is going to be facing medial. This is going to be facing lateral. And that's important we get down here and we talk about the medial epicondyle, right? So you're going to know that that's medial because this is the medial side. It's coming straight down from the head, which is medial. Then you have a lateral epicondyle, which is here. They don't line up perfectly. And that's on the lateral side. Epi means on top or around. So epicondyle is on top of the condyles. And so we'll talk about these condyles. They have special names on the humerus. Back to the proximal. So let's talk about the proximal. You have the head, that is the ball, right? And then you have the anatomical neck. So this is where this kind of sutures on. But we have also what's called a surgical neck because this tends to be what people fracture. So that's why there's a difference. That's not really noteworthy. What is noteworthy is the greater tubercle and the lesser tubercle and the intertubercular groove. So these are the important things here. Intertubercular groove, we're going to talk about, and the greater tubercle and lesser tubercle. So greater and lesser. Now here's the thing, when we talk about the humerus and when we talk about the femur, there's a greater trochanter on the femur and a lesser trochanter on the femur, and there's a greater tubercle on the humerus and a lesser tubercle on the humerus. Graders are lateral. And lessers are medial. And I say this because on the humerus, one doesn't necessarily look bigger than the other. And so rather than just relying on the size, you can just make the rule that with femurs and humeruses, greater is going to be lateral and lesser is going to be medial. So the greater tubercle is this bump kind of off to the lateral side, and the lesser tubercle is a bump kind of on the medial, anterior medial side. Now there's a groove between the two tubercles. So there's a groove here, and this is where your biceps brachii tendon drops through. So it's a groove or indentation between the two tubercles. And because it's between two tubercles, it's intertubercular groove or sulcus. So some books call it a groove. Inter means between, and it's between two tubercles. So it's intertubercular groove or sulcus. Coming down the lateral aspect of the humerus, right here is this bumpy kind of rough patch here. It's where your deltoid muscle, your shoulder muscle attaches. Your shoulder comes out and attaches to mostly the lateral, anterior lateral side of your arm. This muscle pulls up and swings your arm out into abduction. So the deltoid tuberosity is lateral, and it's where your deltoid muscle attaches. Moving down to the distal end. I should say sulcus or groove. The distal end has condyles, but we don't name them condyles. So the lateral condyle is called the capitulum. That is the lateral condyle. Remember, condyles are the rounded ends of a bone that articulate with another bone, right? So it's an area where one bone is going to kind of form a joint or articulation with another bone. And so the lateral condyle is the capitulum, and it is this ball right there. The medial condyle is called the trochlea. And so the trochlea is this more hourglass shape right here. And so the trochlea is also the medial condyle. Then you have this big bumpy thing. Most of you guys have felt this. On the medial side, you have a kind of thing that sticks out right at your elbow, kind of going in towards your body, kind of a pokey thing. That's your medial epicondyle. There. There's a few little fossas here. And so these fossas, there's a fossa here. And then there's another fossa here. And those fossas are indentations where the ulnar bone and the radial bone, so the head of the radius and the coronoid process of the ulnar bone, when you're in full flexion, when you bring your antebrachial area or your lower arm all the way up towards your brachium or towards your upper arm, you're in full flexion. The head of the radius has to have a small space to go into, and so that is the radial fossa. So the radial fossa, and I'll write this out, is a shallow area where head of radius can go. Goes in full flexion. And then we have the coronoid fossa, and that is where the coronoid process of the ulnar bone goes in full flexion. So there are shallow depressions where those things go. So these are on the anterior view. If you look at it from the posterior view, again, you only see the greater tubercle because the lesser tubercle is medial and anterior. You do see the anatomical neck here and the head. The deltoid tuberosity is a little more anterior, but you can see a little rough patch there. But coming on down to the bottom here, again, I know this is medial. Let's do a darker color, right? Because the head face is medial. So this right here is the medial epicondyle. And the lateral epicondyle, because they're the little condyles on top of the big condyles. And so this is kind of showing you the trochlea, which is your medial condyle, and it doesn't really show you the capitulum, which would be here. And so above the trochlea, posteriorly, is a big depression. And this big depression right here is called the olecranon fossa. That is because the olecranon of the ulnar bone, and it's really referred to as olecranon process of the ulnar, that is what we actually call our elbow. It's our elbow. When you're in full extension and your arm's fully extended in a straight line, the olecranon process needs to have a place to go. And so it goes into the olecranon fossa here in full extension. So olecranon process goes into olecranon fossa in full extension. So the good news is when we go through trochlea and olecranon fossa, these things are all going to line up with the ulnar bone. So your ulnar bone is, these are antebrachial, right? So this is your antebrachium. And the ulnar bone is medial. Medial. And the radius is lateral. So the radius is your lateral bone and the ulnar bone is your medial bone. And the ulnar bone forms a hinge joint with the humerus. So it's like a door hinge. And if you look at the humerus, the trochlea here is really where the ulnar bone snaps on to form the hinge. And so we call this the trochlea, and I'm coloring in here. And so the notch that actually kind of snaps onto the trochlea is called the trochlear, and you can't see it, but it's trochlear notch. So you have a trochlear notch on the ulnar bone, and that forms the hinge joint. So if you're looking at it from the side, here's the humerus, right? That's the humerus. I'm not a very good drawer, so don't judge me. But you have the ulnar bone that kind of snaps on here And that's the ulnar. And so it forms a hinge joint, so it can swing into flexion or extension. And so the trochlear notch of the ulnar bone will kind of fit right into and right onto the trochlea of the humerus. So the ulnar bone has this trochlear notch, and if you're looking at an anatomical position, right? So there is a process that is superior and a process that is inferior, because they both kind of make this notch, this kind of curved notch. And so the superior lip of the trochlear notch is what we call the olecranon, right? So the olecranon forms the superior lip of the trochlear notch. And the inferior lip of, let's see, trochlear notch is the coronoid process of ulnar bone. Remember, there's a coronoid process in the mandible. So this is another coronoid process. So it makes up the inferior lip of the trochlear notch. The coronoid process is going to fit into the coronoid fossa on the humerus, and the olecranon process is going to fit into the olecranon fossa on the humerus. So the ulnar bone and the distal end of the humerus have the same names. The head of the radius is going to fit into the radial fossa of the humerus, right? So besides the olecranon process, the trochlear notch, and the coronoid process, you have a few other things here on the ulnar bone. And I'm trying to see, oh, here we go. So this is a great picture because it's showing you upper lip and lower lip. And the lower lip is going to be the coronoid process, and the upper lip is the olecranon process. And so this right here is the trochlear notch, right? And so trochlear notch fits on trochlea of humerus, and then the olecranon process can go into fossa, right? So olecranon fossa and the coronoid process, and this is posterior, and olecranon process in flexion, so this is in extension, and in flexion, coronoid process will go into the coronoid fossa of humerus, and that's anterior. That's anterior and that's posterior. So you can kind of see that. Then there's this notched out, so this is on the lateral side, notched out little area where the head of the radius, radial bone, fits in the radial notch. So the radial notch is where the head of the radius fits in. And then there's an ulnar tuberosity. You don't see too clearly. So that is this area right here. On the radius, and the other thing is you have these little pointy ends of each, the radius and the ulnar bone, and they're both called the styloid processes. So the ulnar, you have an ulnar styloid process and you have a radial styloid process. So you have those at the distal end. The radius, you have the radius come out in this like bump right here, and that is called the radial tuberosity. So this bump, I should say this bump here is the radial tuberosity. And then we have this membrane that goes between the radius and the ulnar bones, and it forms a flexible attachment site for muscles and all the things that we have in our lower arm. And so it's between two bones. Osseous is bones. And we went over that in chapter 5. So inter means between. Osseous is referring to bones. So in between the bones, it's a membrane. It's a membrane in between the bones. And this interosseous membrane is the antebrachial interosseous membrane because it's between the radius and ulnar bone in the antebrachial area. There is a crural interosseous membrane, and crural, or the crus area, is your shin. And so that is the membrane between the tibia and the fibula. So that's why we say antebrachial interosseous membrane, and then we have a crural interosseous membrane we'll talk about a little later. Radius just has the head, there's a neck, there's the radial tuberosity, and then there's the styloid process at the distal end. So you can go through these again. Down here you have styloid process, styloid process. It's kind of showing you styloid processes there, and that's about it. So you go through these diagrams and you can appreciate all these different. The other thing, the antebrachial, as I'm looking at this, I'm not sure why I did that. The other thing that antebrachial interosseous membrane does, and that's not true of the crural, just the antebrachial interosseous membrane, is it's flexible, right? And so it moves. And that's important when you're doing pronation and supination. So in anatomical position, your palms face forward, they are supinated or supine. Supine is when you're laying down face up. So your hands are supine or supinated in anatomical position. When you rotate the radial bone over the ulnar bone, so you're going to move the radius kind of over the ulnar bone, you are crossing the radius over and you are pronating your hands. So when you bring your palm or your thumb, your pollex is usually lateral in anatomical position, and when you rotate it to bring it medial, that's called pronation. And so this interosseous membrane allows the radius to kind of move and cross over the ulnar bone, because the ulnar bone doesn't move. It's a hinge joint. It's that trochlear notch is kind of fits right onto the trochlea and it doesn't move. The radius is what rolls, and it rolls in that little radial notch, right? So the head of the radius is here and it can just roll forward and around. So the radius can move and cross over. So, so this radius can roll, right? And then this rolls over when you pronate hand. So you have pronator muscles that do that. And then you have supinator muscles that bring you back to anatomical position. So moving down, we have carpal bones. Those are your short little bones at the kind of proximal end of your hand. And we'll go through the carpal bones. Then the palm of your hand is made up of metacarpals. So meta meaning with the carpals. And then your fingers are your phalanges. So that are these right here, and those are all your phalanges. There. So, oh, whoops, I included the metacarpal in there. My bad. There you go. Those are phalanges. Metacarpals are these. And then the carpals are these. Okay, so metacarpals, pretty easy because they're Roman numeral 1 through 5. And so usually thumb is number 1. So your pollex or thumb is metacarpal 1, metacarpal 2, metacarpal 3, metacarpal 4, and metacarpal 5. Fairly straightforward. And phalanges are the same, except we now add in proximal and distal. So this is going to be proximal, oops, phalange 1, right? And this is here, proximal flange 2 and 3 and so forth. So this row right here are proximal. On digits 2 through 5 only, you have a middle row. So these are middle phalange. The pollex only has 2 phalanges. So, so you only have a proximal and a distal for that. This right here would be the distal row. So you have 5 distal phalanges. And those are on the end. So this is distal. So no middle phalange for the pollex. So those are metacarpals and phalanges. Now let's talk about the carpal bones. I'll give you the kind of really silly way that everyone's always kind of talked about in anatomy. It really only works if you're looking at the anterior surface of the carpals, right? And so again, it's pretty easy to figure out your thumb or pollex is lateral and your pinky is medial. Anatomical position. And then there's going to be a proximal row of carpals and a distal row of carpals. So let's do the proximal. So you have this one, you have one underneath here, and then you have a separate one on top. So there's really 4 total. And so the first one is actually shaped like an S. You just can't really appreciate it in this drawing, but it's shaped like an S, and that's the scaphoid. The next one, if you pull it apart, it's actually shaped like a crescent moon. So it kind of has that shape to it. Then this bottom one here, because it's really underneath, is the triquetrum. In some books, they call it the triquetral, the triquetrum. And then the little round, right? So it's round like a pea, right? So the peas that you eat is the pisiform. So you have scapula or scaphoid lunate, triquetrum, and then on top is pisiform. That's the proximal row. Distal row, you come back out to lateral. And so when it says most lateral is trapezium and then trapezoid. Then you have capitate and you have hamate. And hamate actually has this little handle that sticks out. This handle right here, it's actually kind of a, if you looked at it in 3D, it's a projection or a little handle off the hamate bone. And so you have that. But there's this lovely little saying that if you go from proximal most lateral to proximal most medial, and then distal most lateral to distal most medial, you have scaphoid and some, you have lunate, lovers, you have triquetrum, you have pisiform for positions, then you go back out lateral, so we're back out to here, trapezium is that, trapezoid, because it's shaped like a trapezoid, kind of. They capitate, can't, and hamate has a handle. So some levers try positions that they can't handle. Again, you have to go lateral, proximal row, across, and then distal, lateral, distal row, across. And that's the way it works. And this is only if you're in the anterior palmar view. All right, lower limb. Let's talk about the pelvic girdle and the lower leg. Now, you have 2 hip bones. Hip bones are also referred to as the os coxae. So you have 2 of those. And then remember, you have the sacrum between, right? So you have an os coxae here and an os coxae here, and then you have the sacrum here. So You can call it hip bone. Os coxae is the, or coxal bone is really 3 fused bones on each side, right? So that's 3 fused bones, and that is 3 fused bones. And the top bone is the ilium. So the ilium's up here. The ischium is down here. We kind of call it our butt bone. And then the pubic bone is in the front. This is anterior, and this is posterior. And so each one of these coxal bones, or os coxaes, have a couple of features. They have the acetabulum and the obturator foramen. When you're looking at it here, this is the largest foramen in the body, or I should say these are the largest foramens in the body. These are the obturator foramens. And the obturator foramens are really the result of these 3 fused bones. There's a muscle that goes through there. And again, I want to orientate you to the fact that these are posterior, and this is going to be anterior, right? And so this is lateral. This is obviously posterior, right? So the sacrum is posterior, and the pubic bones is anterior. So the os coxae is one of them. I'm sorry, the obturator foramen is one of them, and then the acetabulum is the other. The acetabulum is the socket, and the ball and socket joint, which is your hip joint. So the acetabulums are lateral because your lower leg attaches in here. So you have an acetabulum on both sides. So those are really made up of all 3 bones put together. But the rest of it, this is the ilium. And these are the pubic bones. And then this is the ischium in the back and posterior. So we're going to do it a few ways. We'll go anterior structures, posterior structures, and then we'll take them separately. So this is a single os coxae. So let's go through the anterior structures. There are some spines. The spines are pointy here, and then it dips, and then there's another pointy spine here. So you have a pointy spine here and a pointy spine there, and that is where some tendons attach. And so this is the front, right? So this is going to be anterior, and it's higher than this spine here, so it is anterior superior. It's on the iliac bone spine. And then this spine would be the anterior inferior iliac spine. Those spines kind of come down, and they have this arcuate line that forms here. And that arcuate line is in part due to what is referred to as the superior pubic ramus. So you have this strip of bone here. So the purple is the superior pubic ramus. And so this doesn't show the superior pubic ramus, but it's on your list. So a ramus is a strip of bone. So this is the superior pubic ramus, rami. And let's look at the other view. By the way, the pubic symphysis is fibro cartilage that connects 2 pubic bones anteriorly. Okay. So this would be the anterior superior iliac spine, and this is the anterior inferior iliac spine. This would be the posterior superior iliac spine. and the posterior inferior iliac spine is here. So you have those here. These are landmarks that you can feel or palpate when you're trying to assess if legs are the same length. You can physical therapists always pull legs out and look for the anterior superior iliac spines, kind of line them up to make sure the hips are level. Then you can check lower leg length. You don't want the hips one side to be higher than the other because then you're not really assessing limb length. So these are landmarks that we look for. The iliac crest up on both sides, and it connects the anterior superior iliac spine to the posterior superior iliac spine. So it connects those two. So let's go through the features here. And again, obturator foramen. You can't really see the acetabulum. So this is kind of showing you in 3 colors, right? So this is the ilium. This is the ischium. And this is the pubic bone. You can see how all 3 form the acetabulum as well as the obturator foramen. So this is the lateral view. How do I know? The acetabulum is going to be lateral, right? It's always lateral. And so this is the socket, the ball and socket joint. Head of the femur fits into the acetabulum. It's also referred to as the acetabular fossa. So from this side, I always kind of go around the bone, and I like to start at the anterior superior iliac spine and then go down. So that's 1, then I go down to the anterior inferior iliac spine. And then you come down, and the next thing down here is the superior pubic ramus. You have the pubic tubercle, and then you go to the inferior pubic ramus. And then you come around to the posterior side. So this is posterior, and this is anterior. And this lower part, and I'll change color so you can see, this is the ischial ramus. So ramus is a strip of bone, and the ischial ramus and the inferior pubic ramus make up this lower part of the obturator foramen. Then you have a big, thick, rough patch, and this is completely posterior. This is your ischial tuberosity. Your hamstring tendons originate here. This is what you kind of refer to as your butt bone. Right, so if you fall and you hit your bone on your butt, that is your ischial tuberosity. Then coming up here, you have this little notch forming the lower lip of the ischial spine, and that is your lesser sciatic notch. Then you're going to have the ischial spine, and then you have this really great big notch where a big nerve kind of runs through it, and that is your greater sciatic notch. So this is that notch structure right there. That greater notch forms another spine, and that is your posterior inferior iliac spine. You go up, and there is another spine here, which is your posterior superior iliac spine. And again, the iliac crest is this whole crest that connects the anterior iliac spine to the posterior iliac spine. On some of these models and on real bones, you can see the posterior gluteal line, where you have a gluteus minimus, a gluteus medius, and a gluteus maximus. And so they all originate in certain different parts, but you can see that. So this goes through the lateral side. If we look on the medial side, this is your, let me do something a little bit more obvious. This is your iliac fossa. You have a muscle called the iliacus that is in the iliac fossa. And again, this is what we're really looking at here is going to be the more medial. So this is more medial view. You have, again, the anterior superior iliac spine, the anterior inferior iliac spine, the superior pubic ramus, the pubic tubercle, and then you have the inferior pubic ramus. Here. The inferior pubic ramus then merges with the ischial ramus, right? So this is inferior pubic ramus and then ischial ramus, and then you get the rough, bumpy ischial tuberosity. Coming up here, you have the lesser sciatic notch, which forms the lower lip of the ischial spine, and then above that, you're going to have the greater sciatic notch. Then, as you further come up, you have this spine, which is the posterior inferior iliac spine, and then this spine right here, which is the posterior superior iliac spine. The two are going to be connected, the iliac crest, right? So here's the iliac crest. And then you have the iliac fossa. You have the obturator foramen. And a couple of other things to note. Your pelvic opening is, when the pelvis is put together, there's this line that kind of defines the pelvic outlet. And that is your, what is referred to as the arcuate line. So the arcuate line kind of is, on both sides, defines pelvic outlet. The auricular surface here, or the iliac tuberosity, fits with the auricular surface of the sacrum. So this is where the sacrum articulates. There. And so that is one os coxae. Couple of things to note as we look down. So again, this is the arcuate line here. Let me see. So you can kind of see the arcuate lines, how they kind of define this pelvic outlet, right? So when we're looking at this, this is anterior and this is posterior. And these right here are the ischial spines. So that one and that one. And so males versus females. In females, the ischial spines are farther apart because the pelvic outlet is larger. So pelvic outlet in females is kind of this whole space here. It's larger. And so the ischial spines are going to be a greater distance. So this right here is females and this right here is males. They're just, the ischial spines are closer together in males than they are in females. Also the pubic angle. So when we get a front view here, this right here is the pubic angle. And so as you would see, the pubic angle is going to be smaller in males than in females. It's bigger in females. Females have a bigger pelvic outlet. It makes this pubic angle greater for obvious reasons. Babies have to go through this pubic outlet, and so it's a little bit bigger in females, and so their hips are wider and male hips are narrower. Okay, last couple of bones. We have the femur, and again, talking about proximal and distal. So this is the proximal end. And then this is the distal end. And up at the proximal end, you're going to have the head. This is the ball, right? And that fits into the acetabulum of the ilium. Obviously, or not obviously, but hopefully it's obvious, that is going to face medial. So this is the medial side and this is the lateral side. And why do you want to know that? Because when you come down here, you have a lateral condyle and a medial condyle. And if you know that the head is medial, then you know this condyle is medial, right? So that's important. So you have a head and you have a neck. Now, remember I talked about greater and lesser trochanters. Greater trochanter is lateral, and it's bigger. This is hip kind of bump. The lesser trochanter is medial and kind of posterior. So the lesser trochanter is medial and kind of posterior. Now, between these two trochanters, in the anterior view, there is a little line that forms right here. It's where there's raised up bone. And this is the intertrochanteric line. And again, inter means between. Trochanteric means between trochanters. And it is a line. So that's the intertrochanteric line. Please note, intertrochanteric line, now let's do this, is, let me make this so I can, this is anterior. Sorry about that. Is anterior. As far as posterior is the intertrochanteric crest over here. So let's just say this is the anterior view and this is the posterior view. Okay, this is still medial and that's still lateral. So you have this intertrochanteric line that is anterior. Nothing in the shaft, but down at the distal end, you're going to have a lateral epicondyle, and then the lateral condyle, and then the medial epicondyle, and the medial condyle. You're going to have this smooth surface on the anterior surface where your patella sits, and that's the patellar surface. Again, that's anterior because your patella bone is anterior. On the posterior side, again, lesser trochanter is going to be medial. Greater trochanter is going to be lateral. There is a crest that sticks up, and it really is quite pronounced in a real bone. It's a big crest, or kind of a lot of bone material that crests up. And so that is your intertrochanteric crest. It's posterior, posterior. It's like a big crest of bone. I should say built up bone. A little bit distal to that, where gluteals attach, you're going to have your gluteal tuberosity. And then you have this big line. Basically, it's where bone's built up a little bit because you have adductor. Magnus attaches. And where it attaches, it pulls on bone and forms the linea aspera. As well as the supracondylar ridges, you have lateral and medial. And coming down, I don't really ask you about the popliteal surface, but we talk about the muscle. You're going to have the medial condyle, and then the medial epicondyle, and the lateral epicondyle, and the lateral condyle. And there's an adductor tubercle. It doesn't really show up on the bones very well in the lab, so I don't usually have you find that. But there is this fossa or depression here, and that is the intercondylar fossa. So if you haven't gotten the memo, inter means between, and it's between two condyles. And so, and it's a depression, so it's the intercondylar fossa. So I think there's a view that has like a little bit better view that this is a depression there, this intercondylar fossa. So going through these, there's your patella bone. This is the posterior surface where it's smooth, and the anterior surface where it's rough. The kind of indentation or facet where it's smooth that articulates with the lateral condyles, and the medial is a little bit smaller. Tibia bears all your weight. The condyles the distal end of the tibia, articulate with the condyles of the proximal, condyles of the tibia articulate with the distal condyles of the femur. And so to orientate this bone, again, tibia is always, and this is the fibula. There's no tibula, it's a fibula and a tibia. Tibia is medial, and the fibula is lateral. And again, you have the interosseous membrane. It's the crural interosseous membrane because it's in the crus area. Okay, so that's this membrane here. I'm telling you the tibia is medial, which means down at the distal end, you have what is called your medial malleolus. That is the inside ankle bone. So if I asked you to go touch the inside of your ankle and you touch something, you would be touching the medial malleolus. And so if this is the medial malleolus, then when you come up here, this has to be the medial condyle, which makes this the lateral condyle. So those are the condyles on the end. You have a big bump. If you exercise a lot and you use your quadriceps a lot, you're going to have a big bump. It's called your tibial tuberosity. The tibial tuberosity is where all quadriceps insert. So it's where your patella tendon, it's really your patella ligament, but it's where all the quadriceps merge, form one giant tendon, that then the patella is inside that tendon, and then it attaches to the tibial tuberosity right there. So that's the anterior of the tibia. The fibula, you have not too much to write home about. You have the head of the fibula, and then you have the lateral malleolus of the fibula, and that is your outside ankle. So your ankle is really two separate bones. As far as the posterior version, there's really nothing additional on the tibia except in this view, right? So you have the medial condyle and you have the lateral condyle. And in between, you have this bony structure that sticks up. And it sticks up between the condyles, and it's higher than the condyles. And so it's called the eminence, eminence being higher than. So it's between condyles and it sticks up. It's the intercondylar eminence. So this right here is the intercondylar eminence, right? And so there's a lateral medial tubercle, but for right now, you can just call it your intercondylar eminence. And so again, lateral malleolus and head on the fibula, not much else to talk about. As far as tarsal bones, these right here, your tarsal bones. These are your metatarsals. And then we have the phalanges here, right? So phalange, metatarsals, and tarsals. And the tarsals, you have a heel, which is your calcaneus, right? So the calcaneus is your heel bone. And then what sits on top of the this is kind of showing you the bottom view. Let's look at the top view. So calcaneus is your heel. And then the talus actually is this bone right here. And the tibia articulates with the talus. So it basically sits on the talus bone, the tibia and talus. From there, you have this little strip of bone that is medial, and that is the navicular. It's medial, right? Because this is your hallux in your big toe, and that is medial. And this would be lateral. So the navicular is a strip of bone that's medial and right by where the tibia and the talus articulate. Then you have on the lateral side this big boxy square bone called the cuboid. And so it looks like a cube. And then going medial from that, you have three little like triplet bones here, and those are the cuneiform. So that's going to be the lateral, this is going to be the intermediate or middle, and then this is the medial cuneiform. So those are the cuneiforms. So I just usually learn it where you go talus is the heel, or calcaneus is the heel, then talus, and then navicular. Then I go out lateral and I do cuboid, and then I do cuneiforms. And so medial cuneiform is going to be the last one. Metatarsals are like metacarpals in that your hallux or big toe is number 1. It's metacarpal or metatarsal 2, metatarsal 3, 4, and 5. And then as far as digits, you have proximal, right? 1 and distal phalange 1 for the toe, but here you're going to have proximal, middle, and distal for 2 through 5. And those are the phalanges. So going through this, again, you could go through the tarsal bones, calcaneus, talus, navicular, cuboid, and then lateral cuneiform, intermediate cuneiform, and medial cuneiform. And then learn to number these. And then do proximal and distal, right? Oops, it's a big 1. And then this would be 2, right? So there's distal, and you have middle, and you have proximal. So proximal, middle, distal. Your longitudinal arch here, you have your plantar fascia that helps support it, and then the transverse arch to go sideways. Again, navicular, remember it's medial. So this is the medial side, right? It says medial cuneiform. Do we have variations in skeletal bones? Yes, we do. And I'll tell you the most is basically inherited, genetic, but muscle mass, how much muscle you have, plays a huge effect on tubercles, tuberosities, trochanters, anything that's pulling, any kind of musculature that's pulling on the bone is going to make a big difference in the size of these things. You know, medical history, if you have a malabsorption issue or you're taking medications, and then obviously testosterone for males tends to promote bone density and bone growth. It's less in females with estrogen, and age plays a role too, because the bones are bone density is determined by hormones to a large extent. So this just is a couple of other tables, age-related changes, which I choose not to look at anymore because I'm older than 50 and it kind of sucks. But other than that, that is going through chapter 7. And when we meet to go over this, I'm hoping to have some actual skeletal bones so I can zoom those with you. And that's it for today.